Hi, very good morning. I'm Dr. Janak Patel, MD, General Physician. Today we'll be talking on one of the very useful topic in your everyday practice. It will be useful to you, your family, and even to society. That is use and misuse of steroids. Now you know very well steroids is a broad term which will include many molecules. Basically, when you call steroid means it is having a typical molecule which is manufactured from cholesterol, and this is being manufactured by adrenal gland we call cortex. So we'll be talking on that particular part. So basically when you use steroid, it is a broad term. By and large, when the steroid word is utilized, it is taken for granted glucocorticoids. Steroid also includes mineralocorticoids. Together we call corticosteroid. There is another steroid we call anabolic hormones or anabolic steroids, which is also manufactured by adrenal cortex. So when you say steroids, it is taken for granted corticosteroid, meaning steroid from adrenal cortex, corticosteroids, which will include mainly glucocorticoid, mineralocorticoid, and also it includes androgens. Basically, steroids are life-saving drugs or life-saving hormone. It is also called as a stress hormone. But instead of a use, there are a lot of misuse, and that can lead to a lot of complications. We'll be talking on both the aspects, how it is a life-saving and how it is misused. So it includes glucocorticoid and mineralocorticoid, and both are life-saving. We'll be talking under introduction types, what are glucocorticoids, indications. Mainly we'll be concentrating more on glucocorticoids rather than mineralocorticoids, indication, contraindications, and then little idea regarding androgenic steroids. And mainly these are the hormones which are being abused maximally, or we call misuse. So when you use the word corticosteroid drugs, in short we call that as steroids. But by and large, when we say steroids, it includes glucocorticoid as well as mineralocorticoid, and also it includes other also. Steroid are 17 carbon compound which is having cyclopentanoperhydrophenanthrin ring, and that we call as a steroid nucleus, and it is synthesized by adrenal cortex from cholesterol. We'll see in this particular slide. Next slide. So ACTH will stimulate adrenal cortex, and in adrenal cortex cholesterol will now be converted into aldosterone. I'm not going into all this detail. It will be also converted into cortisol. This is glucocorticoid which is released from adrenal cortex. Also there will be manufacture of what we call as androgen, we call as a testosterone. This is mineralocorticoid, this is glucocorticoid, and this is androgens, or we call as a male hormone. Also there will be production of estradiol, that is a female sex hormone. These two are adrenal cortical sex hormones. Also there is a little amount of production of estradiol, estriol and estradiol. All this will be accounting for what we call as a sex hormones. which are in a very small quantity. Main is cortisol and aldosterone. And this is mineralocorticoid, this is glucocorticoid. And these are what we call as adrenal cortical sex hormones, or we call androgenic hormones. Adrenal cortex is stimulated by angiotensin 2 and by ACTH. Angiotensin 2 will stimulate zona glomerulosa, the outermost layer of adrenal cortex, which will manufacture and release aldosterone. And this aldosterone will act on distal convoluted tubule and will reabsorb sodium along with water, by which it will increase blood volume, and by increasing the blood volume, cardiac output is increased, blood pressure will be elevated. As well as aldosterone has got effect on many other structures, and this particular aldosterone, when it is in excess, it can result into hyperaldosteronism, which is dangerous for the body. I have already discussed this in endocrinology chapter. We call hyperaldosteronism. So if you are interested, you can go through in that. While there is an hormone which is secreted from pituitary gland, we call ACTH. This ACTH is released from pituitary gland because of stimulation of ACTH releasing factor, or we call corticotropic releasing factor, which is released from hypothalamus. And there are some of the conditions which gives rise to stimulus of this release of CRH, or we call ACTH-RH. They are released because of stress, hypoglycemia, and many other factors. ACTH will now stimulate adrenal cortex, zona fasciculata and zona reticularis, by which it will release cortisol, that is glucocorticoid, and also there will be small quantity of adrenal androgens. So for glucocorticoid, ACTH is a stimulus, and for aldosterone, angiotensin 2 is a stimulus. This angiotensin 2 is released from what we call as a conversion of angiotensin 1 into angiotensin 2 by angiotensin converting enzyme, and then it will be acting on a zona glomerulosa. This is by means of a RAS system. So adrenal cortex has got outermost layer zona glomerulosa, which will manufacture aldosterone, we call mineralocorticoid. Fasciculata will manufacture cortisol, we call glucocorticoids. And innermost layer, what we call the zona reticularis, will manufacture mainly androgens. Corpus luteum of the ovary will manufacture progesterone and estradiol. A small quantity of estradiol is also manufactured by adrenal gland, that is cortex, zona reticularis, a small quantity. And testes will manufacture testosterone and dihydrotestosterone. So little quantity of testosterone is also manufactured by zona reticularis. There is another steroidal hormone we call as vitamin D3. This is mainly concerned with calcium metabolism and bone mineralization. I am not going into detail regarding that, but this is one of the steroid. But we are going to talk mainly of glucocorticoids, little amount of mineralocorticoids, and little amount of androgens. So we divide into three groups: anabolic, corticosteroids, and androgenic steroids. Anabolic are most commonly abused steroids, and they are to increase the muscle mass and strength. Basically, these are synthetic products of androgenic hormones. Anabolic effect of this androgenic hormone is for bone, muscle, vocal cords, etc. And these anabolic hormones are also utilized to treat hereditary angioedema, Behçet's, aplastic anemia, etc. There are good amount of use. We'll be talking about some of those use in last part of the lecture. While mainly we'll be talking on glucocorticoids, that is cortisol, and you have got a synthetic preparation we call cortisone. We have got different types of products, and there are lot of uses, but good number of time there is misuse, or we call overuse, or we call abuse. Now to understand this particular part, you should understand this particular slide, that every day adrenal cortex will secrete 5 to 30 milligram of cortisol and 2 to 5 milligram of corticosterone. So you can understand, if you are giving more than this amount, which is daily secretion, it is going to produce side effects. So whenever glucocorticoid is given in a little larger doses and every day for a longer period, it is going to give rise to side effects. It is most important stress hormones for many functions. As we go through, we'll be discussing on that. Mineralocorticoid secretion is in a very small quantity. You can see 5 to 150 microgram, while this is in a traces. So these hormones, aldosterone is secreted for mineralocorticoid activity, that is for sodium balance, which will indirectly have effect on a blood volume, indirectly will have effect on a cardiac output and blood pressure. Well, these are not of much importance, because androgenic hormones secretion is 15 to 30 milligram, progesterone is 0.4 to 0.8 milligram, and estrogen, you can see estradiol, a very small quantity. So mainly androgens is manufactured, and this is overall we see that mainly it is by testis rather than adrenal gland, that is zona reticularis. We'll be talking mainly on this particular aspect, that is cortisol, or we call glucocorticoids. Glucocorticoid will have effect on carbohydrate, protein, lipids, electrolytes, that is sodium, calcium, potassium, water, cardiovascular system. So by having effect on all this, on cardiovascular system, skeletal muscle, CNS, also it will have effect on stomach, blood, anti-inflammatory property, immunosuppression, on respiratory system, growth of a cell, cell division, bones, calcium metabolism, etc. Many more things. Indirectly, the main effect of cortisol is on blood sugar. It will increase the blood sugar level, being a stress hormone, which will provide energy, decreases immunity. By acting at the serotonin level, it has got effect on what we call as the brain functions. On calcium metabolism, it regulates the metabolism of protein, fat and carbohydrate. It retains sodium. So these are, it decreases the inflammation. These are all the combined effects. So it will have an effect on CNS, cardiovascular system, immune system, musculoskeletal system, eye, respiratory, glucose and liver metabolism, reproduction, skin, etc. We have got one slide, we'll be discussing in that. We have got the natural glucocorticoids and we have got synthetic glucocorticoids. Glucocorticoid naturals are cortisol and corticosterone, while mineralocorticoid is mainly aldosterone, and there is a very small quantity of deoxycorticosterone. This is almost in traces. So Synthetic preparations are mainly prednisolone, betamethasone, dexamethasone, etc. Here we can say hydrocortisone, prednisolone, methylprednisolone, triamcinolone, deflazacort, dexamethasone, betamethasone, etc. These are all what we call as the synthetic preparations. And this fludrocortisone is a synthetic preparation. So we have got natural, which are manufactured in our body by adrenal cortex, and synthetic preparations are available. So these are natural. Mineralocorticoid is aldosterone, glucocorticoids is cortisol, or we can call as hydrocortisone. These are all synthetic preparation. Hydrocortisone, which is short acting. This is little longer acting. There is an intermediate acting like prednisolone, triamcinolone, and further longer acting, which is almost acting for nearly 36 to 72 hours like dexamethasone, betamethasone. There are some steroids which can be utilized only by inhalation like fluticasone, budesonide, beclomethasone, etc. There are some topical preparation. This preparation cannot be given orally or parenterally. Clobetasol, mometasone, this is also utilized in inhaler preparations. As far as mineralocorticoid, which is a synthetic preparation, fludrocortisone. These are all the different types of preparations which are available. We'll be talking little bit aspect of all those. The drugs which can be used orally or transrectal or IV or intramuscular, this we call parenteral. They will have a systemic effect, means effect on entire body. But when you apply that topically, say over the skin, it will be local effects. And if it is absorbed from that local area, now it will produce systemic effect. So long-term use of topical applications. Intranasal spray can be used, intraocular, intraarticular, or in the form of inhaler. These are all locally acting, but they can be absorbed from that local area and can have systemic effect if there is an abnormal use. And there is good amount of abnormal use as far as inhaler is concerned, intraarticular is concerned, or sometimes what we call is a topical application in the form of a skin ointments. Lot of misuse are there in that. The main use of glucocorticoid is for replacement therapy, and mineral corticoid is also used for replacement therapy. Anti-inflammatory therapy can be short acting like hydrocortisone, intermediate acting drugs like prednisolone or methylprednisolone. Triamcinolone is not commonly utilized, and very long acting preparations like dexamethasone and betamethasone. These are the different types of preparation we call short acting, intermediate acting, long acting. So depending upon the indications, how you want. So glucocorticoid can be given per oral in the form of tablets, drops, capsules, etc. and parenteral from intramuscular or IV. It can be used topically, and we have already shown you topically in the form of a skin ointment, nasal spray, intraocular drops, etc., intraarticular injections, and inhalers. These are all the different types of those preparations. You can give glucocorticoid rectally, which can be absorbed from rectum and can have systemic effect and can have a local effect also. Or you can inject into the joint, we call it an intraarticular injection, mainly in a case of a inflammation like osteoarthritis, rheumatoid arthritis, etc. So local are intranasal, intraocular, rectal preparations, intraarticulars, topical, inhaler. Oral are mainly in the form of tablets and liquids, and parenteral can be intramuscular, IV, and there are some preparations which are called depot preparations. and in a depot preparation it is acting for a long period. So when it is given in a form of a depot preparation, that particular drug will be slowly released and it will act for few days to few weeks up to months also. So those are depot preparation. And there are some preparation in the form of IV which are highly concentrated and they contains a large dose of steroids. So glucocorticoid, we have got short acting, intermediate acting, long acting. We have got mineralocorticoid. We have got some of the natural preparations like ACTH. We have got synthetic preparation like prednisolone, dexamethasone, betamethasone, hydrocortisone, deflazacort, beclamethasone, triamcinolone, etc. Glucocorticoid can be available in the form of oral, tablets and liquid, topical, parenteral preparation, inhalers, enema, intraarticular. Mainly in intraarticular, triamcinolone is available. Injectable in the form of a dexamethasone, betamethasone, and long-acting preparations, dapomedrol, which can be intramuscular. These are depot preparations, and there is a very large dose available like solumedrol, which is almost in one drip. You give 1000 milligram of prednisolone, a very large dose, 1 gram you give. So these are all the preparations and these are equivalent doses. You can see 25 milligram of cortisone is equivalent to 20 milligram of hydrocortisone is equivalent to deflazacort only 6 milligram. And as far as prednisolone is concerned, 5 milligram, methylprednisolone is 4 milligram, triamcinolone is 4 milligram, and see the comparison with dexamethasone. It is 0.75 milligram only. And routine tablets which are available is 4 milligram. You can just imagine it is 6 times more dose, and this is also nearly same betamethasone. So these are highly potent, and you can see the half-life. So biological life is almost 36 to 72 hours, very close to 36 to 54. It is nearly 72 hours, and these are short acting 8 to 12 hours. 8 to 12 hours. These are all 8 to 12 hours, while intermediate actings are 24 to 36 hours and long acting are more than 36 hours, and even they are acting for up to 72 hours. So these are all the different types of preparations which are available. At your leisure time you can go through. These are topical preparations, different types of topical preparations. We know that beclamethazones are very potent, while these particular preparations are moderate, and hydrocortisone preparations are very mild one. Hydrocortisone preparations are very mild one. This is little concentrated. Why we get adverse reaction? One, because of sudden withdrawal, and second, because of supraphysiological doses. Understand this very well. First, I'll explain supraphysiological doses. We know that everyday secretions of certain glucocorticoids is say 20 to 30 milligram. But when you give a dose which is more than that, there is a negative feedback which is acting at the level of pituitary and also acting at the level of hypothalamus, where there is an inhibition of secretion of corticotropic releasing hormone, as well as there is a inhibition of ACTH release. And because these are not released, there is no stimulation of adrenal cortex. So slowly adrenal cortex stops functioning. If these supraphysiological doses are continued, there will be suppression of, we call hypothalamic pituitary adrenal axis, HPA axis. And when you stop that drug suddenly, there is no production from adrenal gland. So there will be sudden adrenal gland insufficiency, adrenal hormone insufficiency, both hydrocortisone as well as mineralocorticoids, and that will lead to acute adrenal insufficiency, and person can develop acute adrenal insufficiency. This is called sudden withdrawal, but that sudden withdrawal is of a dose which is supraphysiological. If you are say giving say 5 milligram of prednisolone every day, if I show you this particular chart, say you are giving 5 milligram of prednisolone, clear? It is equivalent to 25 milligram of cortisone. I am going through backslide. You can see the secretions. It is 30 milligram. It is almost parallel. Means if when you are giving 5 milligram of prednisolone every day, it is almost equivalent to daily requirement. But say instead of that, say it is 25 here, cortisone. So instead of that 5 milligram, say I am giving 2 tablets TID, means 6 tablets. So I am giving 30. So that 30 will become, indirectly you can see here, that will become cortisone secretions. Parallel will be 150. 150 is a supraphysiological, and that will start producing two things. One, at the level of adrenal cortex, it will be inhibited because of negative feedback. No secretion of corticotropic releasing hormone, no secretion of ACTH. Adrenal cortex is no longer stimulated. Adrenal cortex stops functioning, stop manufacturing glucocorticoids and mineralocorticoids. And when there is a sudden withdrawal, you can end up with acute adrenal insufficiency. At the same time, what is happening? Because of supraphysiological dose, you are having excess of effect of this external glucocorticoids which you have given, and that will start producing side effects. So supraphysiological dose will produce two things. One, suppression of a hypothalamo-pituitary adrenal axis, as well as there will be excess of action of glucocorticoid, and that will start producing side effects. And because of sudden withdrawal, person will have acute adrenal insufficiency. Also, there will be effect like malaise, fever, arthralgia, myalgia. It can also produce increased intracranial pressure with papilledema, and it is described as pseudotumor cerebri. And you will require steroid replacement in case of acute adrenal insufficiency. So risk of side effect will depend on one, doses, type of steroid, length of treatment, and other medical problems. Say we are giving some of the little idea. Say if I am using a very low dose, less than 10 milligram per day, chances of getting side effects will be less, suppression of HPA axis will be also relatively less. But if you are using say 20 milligram every day, chances of side effect will become more, and suppression of HPA axis will be also more. As far as duration of action is concerned, say if I am using short acting steroid, say like I am using hydrocortisone, it is a very short acting, the action wears off, so chances of HPA axis inhibition will be less, relatively less. But if I am using say long acting like dexamethasone or beclomethasone or betamethasone, then it will have effect lasting for a longer period, and potency wise they are highly potent. So 4 milligram is equivalent to 6 times the dose of prednisolone. So indirectly it is almost becoming a supraphysiological doses, and if you are giving BD, TID, etc., it will produce a suppression of HP axis, as well as it will start producing side effects because of glucocorticoid activities. And then comes length of treatment. Longer the treatment, more the side effects and more suppression of HP axis. And if it is given in a higher doses of long acting for longer period and in presence of certain disease, say like person is having diabetes or hypertension, or say person was having duodenal ulcer, all those will be exaggerated and you will start getting complications of those particular disorders. So dose dependent complications like hyperglycemia, hyperlipidemia, peptic ulcer, CNS side effects like psychosis, anxiety, depression, etc. And longer the duration, the person will have a high chance of hypertension, Cushingoid features, or we call androgenic Cushing, growth impairment, osteoporosis, fracture, osteonecrosis, and opportunistic infections. So higher the dose, this will be more likely in a short period, and longer the duration, hypertension, Cushing's, growth impairment, osteoporosis, osteonecrosis, opportunistic infection, etc. Longer you give, even a small doses also can produce those side effects. So it is beneficial, but abnormal use can produce bad effects or very, very bad effects. We call ugly. So do remember, some of this preparation, say Solumedrol, contains a very large quantity. Dexamethasone is 6 times more powerful as compared to prednisolone. So steroid can be good if it is used for inflammatory purpose, but it will become bad when it is used in a little larger doses, and it is very, very bad, or we call ugly, if it is used for longer period and dose is also large. So do remember this. These are some of the side effects given in a short, very, very short. By acting on a glucose metabolism, it will give rise to hyperglycemia and diabetes mellitus, which we call as androgenic diabetes mellitus or endocrine induced diabetes mellitus. As far as fat is concerned, redistribution of the fat, and it will give rise to Cushingoid features like moon face, buffalo hump, fish mouth appearance, central obesity. Sometimes it is also described as potato on stick or lemon on stick. As far as protein is concerned, it is anti-anabolic, so there is loss of protein from muscle resulting into negative nitrogen balance, muscle atrophy, weakness, proximal muscle weakness. On calcium, it decreases the absorption and increases renal excretion, by which it results into bone resorption, osteoporosis, fractures, deformities, etc. And because of bone resorption, there is a decrease in linear growth also, stunted growth. Skeletal muscle, we have already told you. Proximal muscle myopathy can be there because of wasting of the muscle. It inhibits prostaglandins, by which it increases the chances of peptic ulcer formation, and there is increased acid production. So peptic ulcer chance are increased, and if already it is there, the chances of bleeding and perforation becomes high. As far as sodium is concerned, it results into sodium retention, because of which there is water retention, increase in blood volume, edema chances, hypertension, secondary to hypertension, LVH, etc. On CNS, because of action on the serotonin, there is mood swing, it decreases the seizure threshold, and there is a water retention. Hence, because of effect on the CNS, it can give rise to psychosis, anxiety, depression. Even epilepsy can be precipitated. It can result into glaucoma because of water retention, and also it can end up with intracranial pressure elevation. We call pseudotumor cerebri. As far as the reproductive system is concerned, along with increased action. There is increased androgenic effects which will produce hirsutism, acne, and action on the skin. It will give rise to stria. Because of anti-inflammatory effect, there is anti-allergic property. This is favorable. There is decreased mucosal edema, decreased bronchial hyperreactivity, which is also favorable, which is helpful in case of a bronchial asthma. But because of T cell destruction, decreased immunity, there is an immune suppression effect, which is also favorable in autoimmune disorders. But in absence of those, because of immune suppression, it will delay wound healing. There will be increased chance of infection, bacterial, viral, tubercular, as well as fungal. So this is unfavorable effect, delayed wound healing, secondary infections, or we call opportunistic infection, unfavorable effect. But anti-inflammatory effect, anti-allergic effect, and immunosuppression can be utilized in treatment part of certain diseases. I am not going into these particular slides, few of these slides. These are short-term side effects. These are long-term side effects on musculoskeletal system, metabolic, etc. At your leisure time, I already discussed in previous. So these are many more. So you can go through your at leisure time. This is another put into another way: psychiatric, soft tissue, neurogenic, cerebrovascular, musculoskeletal, endocrine, immunological, eye, and developmental. All we have discussed before. This is because of prolonged use, means duration is longer and higher doses. So supraphysiological doses for longer period. Same thing mentioned here. This is iatrogenic. We can get Cushing features, or we call Cushingoid syndrome, or iatrogenic Cushing. These are all the features again mentioned in detail. You can go through your leisure time. This is another way to remember what are the effects, or we call side effects, because of higher doses, long acting drugs used for longer period. You can remember corticosteroids. C for Cushing syndrome, O for osteoporosis, R for retardation of growth, T for thinning of the skin, I for immunosuppression, C for cataract and glaucoma, O for edema, S for suppression of hypothalamic pituitary adrenal axis, T for teratogenic, E for emotional disturbances, that is CNS effect, R for raised blood pressure, that is hypertension and left heart failure, O for obesity, central obesity or truncal obesity we call, I for hirsutism, that is increased body hair growth, D for diabetes, and S for stria. You can remember whichever way. This is one way of remembering. We call Cushing corticosteroids. There is another way, glucocorticoid. G for glaucoma, L for muscle atrophy, U for peptic ulcer, C for cataract, O for osteoporosis, C for Cushing syndrome, O for osteonecrosis, R for retardation of growth, T for thinning of skin, I for infection, C for change in the moods, that is psychiatric effect, O for edema, I for impaired healing, D for diabetes, and S for suppression of HPA axis. Whichever way you want to remember. And these are why that happens, partly it is given. So at your leisure time you can go through. This is another way to remember: action on sugar, sodium, serotonin, immunity, calcium absorption. Action on sugar will be this, sodium will be salt, serotonin will be sex and sadness, immunity will produce sickness, that is secondary infection, and calcium will stop the growth and shrinkage of the bone, etc. And there will be cosyngoid features because of excess of effect, and because of suppression and sudden withdrawal, you can get adrenal insufficiency, which can produce confusion, muscle weakness, hypotension, low glucose, low sodium, etc. What ideally you should do whenever you start little higher dose, giving for little longer period, and you are using long acting drugs. If it is given for a longer period, at the end of the 1 month, and then after 2 to 3 months, always go for blood pressure, weight, height and weight, and also look for other side effects. Every 6 months, you should have a ophthalmic checkup. And as far as laboratory is concerned, at 1 month and after 3 to 4 months, potassium level, because it produces hyperkalemia, fasting blood sugar, triglycerides. And when you stop treatment, look for cortisol level to rule out hypothalamic, pituitary, adrenal axis suppression. Because when you stop, cortisol level should not be 0, and it should be estimated between 8 to 9 am, because that is the peak where the highest production of cortisol is there. So try to look for this. This is called follow-up protocol system. What ideally you should teach the patient? Teach the patient how to take the medicine, at what time it should be taken, and by and large it should be given what we call as in relation to circadian rhythm, and also explain the person regarding the adverse side effects. So if there is any adverse side effects, he should contact. Look for WBC and signs of infections, and monitor for blood pressure and weight. This is most simple. Now indications, main indications which is absolutely necessary, or we call absolute indication, is replacement therapy. Means because there is a lack of endocrine hormone production, you have to replace from outside, say like adrenal insufficiency. We'll be talking on that. That is Addison's disease, and it is life-saving indications like acute adrenal crisis. It is absolutely necessary where there is no lack of glucocorticoid production, but you require a increased dose of glucocorticoid, like in anaphylactic shock. It is also sometimes life-saving in case of SLE complications, pemphigus vulgaris, and in case of status asthmaticus, where in these conditions you require a large dose. So person can have a life-threatening complications in anaphylactic shock, SLE, pemphigus vulgaris, status asthmaticus, and person can have a high mortality. So in those conditions, it becomes a life-saving indications. As far as rheumatic disease is concerned, again it can be life-saving when there is an acute myocarditis or there is an acute endocarditis. In some of the renal disease also, like acute glomerulonephritis, it can be life-saving. In some of the disease, we'll be going into detail, like severe allergic angioedema, certain skin disorders, some of the GI tract disorders, hepatic, ocular, malignancy, etc. It can be life-saving. But in case of hyposecretions of glucocorticoid or mineralocorticoid from adrenal cortex, it is a hormone replacement therapy. You can utilize also as a diagnostic purpose to find out hypothalamic pituitary adrenal axis by doing what is called as a dexamethasone suppression test. Because when you give a dexamethasone, it will inhibit pituitary and hypothalamus, by which as soon as it is inhibited, the production from adrenal cortex will reduce, and that can be taken as to find out where is the suppression, whether it is at the hypothalamic level, whether it is at the pituitary level, or whether it is at the adrenal cortical levels, and it can be utilized for finding out that. So when you utilize for non-endocrine conditions like this, anaphylactic shock, SLE, pemphigus, all this, rheumatic disease, etc. It is called palliative treatment, or it is also called as a pharmacotherapy, or combined together we call palliative pharmacotherapy. It is for a temporary purpose and to tide over the crisis. So for palliative purpose, you can utilize in a short duration or for a longer duration depending upon the severity of the disease, etc. So this slide gives you an entire idea regarding which are the property of glucocorticoid we are utilizing in different disorders. Say like we are utilizing the property of glucocorticoid as far as production of glucocorticoid from adrenal gland is concerned. Acute adrenal insufficiency, chronic adrenal insufficiency, we call as Addison's disease, and adrenogenital syndromes, or we call adrenal virilism. In that also you can utilize hormone replacement therapy. These are some of the conditions where you can utilize that particular, and you can also utilize what we call as in suppression test. So this is the main use: acute adrenal insufficiency, chronic adrenal. I am not going into detail regarding what are the causes of acute adrenal insufficiency, what are the causes of chronic adrenal insufficiency. We are not going into that detail. So in this condition you can utilize this, and in acute adrenal you will have to give glucocorticoid with mineralocorticoid, and in case of Addison's disease also you might require glucocorticoid with mineralocorticoid activity, that is fludrocortisone. While in adrenogenital you will require ACTH plus you might require androgenic hormone from outside. Sorry, you will require ACTH to suppress androgens production in adrenal virilism, that is adrenogenital syndrome. Anti-inflammatory property will be utilized in rheumatoid arthritis, osteoarthritis, rheumatic fever, gout, bronchial asthma, collagen disorders like RA, SLE, periarthritis nodosa, in nephrotic syndromes, ocular disorders, cerebral edema, ulcerative colitis. In all these conditions, we utilize anti-inflammatory property. In some of the disease, we utilize immunosuppression property of glucocorticoid like autoimmune hemolytic anemias, ITP, idiopathic thrombocytopenic purpura, and also in case of organ transplant to suppress the immunity because the person has undergone organ transplant, so that we don't have a rejection phenomena. Also in certain malignancy like lymphatic malignancy, that is lymphomas, lymphatic leukemias. We also utilize the property of glucocorticoid action on calcium because it reduces the calcium absorption and increases the calcium excretion by kidney, by which it reduces the calcium level. So it can be utilized in a person with severe hypercalcemia, secondary due to malignancy, quite common, or vitamin D intoxications. In those conditions, there is a dangerous level of calcium producing severe hypercalcemia. You can utilize glucocorticoid for that particular purpose. So in that condition also you can have use of glucocorticoids. Anti-allergic property is utilized for skin allergies, bronchial asthma, and some of the skin diseases like eczema, etc. Diagnostic purpose, dexamethasone suppression test. So this is in general very nicely explained What are the different properties of glucocorticoid we can utilize? That is lack of hormone, anti-inflammatory property. This is called pure replacement therapy, and this is non-endocrine use, or we call as pharmacological use, pharmacotherapy, or we call palliative therapy. So anti-inflammatory property, immunosuppression property, anti-allergic property, acting on calcium, etc. These are some of the things which are being utilized. So, and depending upon the disorders, we can use systemic or topical. Say for the skin, most commonly it is topical preparation which can do. In a case of a bronchial asthma, also inhaler can do. So these are for topical applications. So you use topical like inhalers, local drops, ointments, etc. Because when you use topically, you are giving in a very small dose topically. So chances of systemic effect is less. HP axis suppression is almost minimal. But when it is abused, excess of dose is taken even without requirement, it can have a systemic effect, and it can suppress, and it can have a systemic side effects. Mineralocorticoid is utilized mainly in person who has got hypoaldosteronism, or along with damage to adrenal cortex, there is decreased production of mineralocorticoid along with glucocorticoid, say like in acute adrenal damage, acute necrosis of adrenal gland, say like Waterhouse-Friderichsen syndrome. In that, you will require glucocorticoid with mineralocorticoid. Now, we have already told you, a short-acting drugs will have less suppression of HP axis because it is used for a very short period. Say like in case of an acute adrenal insufficiency, status asthmaticus, anaphylactic shock, etc., where you are using a shorter acting drugs for a short period, like hydrocortisone. But when you use intermediate acting drugs like prednisolone for anti-inflammatory property, anti-allergic property, immunosuppression property, there is less suppression of HP axis. So withdrawal of this drug may not produce acute adrenal crisis. But when you use a long-acting drugs for longer period, because they are highly potent, there is a severe suppression of HP axis because they are highly potent and you are using for longer period. The chances of cerebral edema, you commonly use in a cerebral edema for lung maturation, etc. But if it is used for a longer period, the side effects are more and you can have a withdrawal syndrome. So do remember this. So it will also depend upon the type of preparation what you are using and duration of preparations what you are giving, how long you are giving and how you are giving, whether you are giving systematic or whether you are giving topical. Topical will produce minimum side effects. So common therapeutic use is replacement therapy, mainly for acute adrenal crisis, and side effect will depend same like other steroids. So replacement therapy is mainly in acute adrenal insufficiency in the form of a IV bolus. Usually it can be right from 100 milligram to 400 milligram of that in a continuous infusion every 8 hours till the person is stabilized, and then person is shifted to the maintenance dose. In a chronic, you will give daily treatment for hydrocortisone with fludrocortisone orally. In a congenital adrenal hyperplasia, you will have to give a daily treatment of hydrocortisone with fludrocortisone orally till the person is stabilized and then shifted to the maintenance dose. These are all the endocrine conditions: acute adrenal insufficiency, primary adrenocortical insufficiency, secondary to anti-pituitary gland means panhypopituitarism, congenital adrenal hyperplasia, which will give rise to what we call as adrenogenital syndromes, chronic adrenal insufficiency, Sehan syndrome, post-adrenalectomy in Cushing's, Waterhouse-Friderichsen syndrome. In all these conditions, you will require large dose of short-acting glucocorticoids, and you may require additional fludrocortisone, that is mineralocorticoid. In case of a thyroid storm, subacute thyroiditis, malignant exophthalmos, you may require glucocorticoid as additional to control of thyroid disorder. During this acute adrenal insufficiency, you will also require IV saline because there is decreased sodium. You might require glucose barrier, there is decreased glucose level. You will require hydrocortisone in little larger doses, frequent doses, and then switch over to oral preparations or intramuscular preparations once the person is recovered. In Addison's disease, when you switch over, you can give oral cortisol and fludrocortisones. This is typical finding of Addison's disease, usually in a chronic variety. What you come across, I am not going into detail. And this is what you come across in an adrenal crisis, where person has got profound fatigue, dehydration, severe hypotension. You might have a renal shutdown, serum sodium is low, and potassium will be very high. So this will be very typical, which you will come across. Person will have even hypoglycemia. So hypoglycemia, hypotension, weight loss, hyponatremia, hyperkalemia, you should suspect, and bronze pigmentation of skin, or usually we call blackish pigmentation of the skin. That is a classical Addison's. To diagnose a Cushing syndrome, whether it is ACTH dependent or non-ACTH dependent, dexamethasone suppression test is very, very useful, because when you give dexamethasone, it will suppress ACTH. So if it is an ACTH dependent, you will have a decreased level of cortisol. But if it is a non-ACTH dependent, there will be no effect on cortisol production because it is outside the adrenal gland. And that will be the way you can differentiate ACTH dependent or non-ACTH dependent Cushing syndrome. And also you can utilize to find out the source of androgen production in hirsutism by dexamethasone suppression test. You can find out that also, whether it is from adrenal gland or it is outside the adrenal gland. So you can utilize that to find out primary insufficiency, secondary insufficiency. That is, in primary, because there is no function of adrenal cortex, there will be no increase in cortisol level. And in secondary insufficiency, there will be increase in cortisol level, because when you give ACTH, it will stimulate adrenal cortex and increases the cortisol level. But in primary, it is a basic damage to the adrenal cortex, so there will be no change in a cortisol level. So cortisol level will be very low. It will not increase. But in case of secondary, it will increase. You can utilize also to, in case of a Cushing syndrome, to find out whether it is ACTH dependent or ACTH independent. So that is another way. So for diagnosis of HP-axis status also, you can utilize ACTH stimulation test. So it is called adrenocortical functions. You can identify an HP suppression test you can do by using ACTH. These are non-endocrine use. In allergic reactions at your leisure time, there are many conditions. Still good number of conditions may not be mentioned here. So in allergic reaction, collagen vascular disorders, eye, gastrointestinal, hematological, systemic inflammation, infections, inflammatory conditions, neurological conditions, organ transplant, respiratory disorders, renal disease, skin disorders, thyroid disorders, and miscellaneous. Good number of conditions. So there are large number of use of this, which we label that as a neuroendocrine disorders, and all this previous what we have mentioned, these are endocrine disease, or we call hormone replacement therapy. In this you have to replace hormone because there is no hormone production or hormone levels are markedly reduced. While in all these conditions, and these are two conditions where you use for diagnostic purpose, dexamethasone suppression test and ACTH stimulation test. And these are non-endocrine use, or we call as pharmacotherapy. In all this you can use the property of steroid. So you are giving little extra dose of steroid by which you want to treat these different conditions, and you are utilizing different properties, allergic property, immunosuppression property, etc. So these are the different way depending upon the disease: rheumatoid arthritis, osteoarthritis, rheumatic fever, collagen disorders, severe allergic reaction like angioedema, anaphylaxis, autoimmune, bronchial asthma, eye, skin, intestinal, cerebral edema, malignancy, organ transplant, and even for the diagnostic test for adrenal pituitary axis. This is another way to remember, like A, B, C, D, E, F, G, etc. Whichever way you want to remember. I'm skipping this slide. This is anti-inflammatory property. This is immunosuppression. We have already divided before also. Anti-inflammatory property is utilized in rheumatoid arthritis, osteoarthritis, skin inflammation, ocular inflammation, ulcerative colitis, etc. While immunosuppression in collagen vascular disorders, in transplant, multiple sclerosis, nephrotic syndrome, immune hemolytic anemias, etc. These are allergic reactions like serum sickness, urticaria, angioedema, cerebral edema. For malignancy like acute lymphatic leukemia, bronchial asthma, etc. These are all the different conditions where you can utilize. You can use glucocorticoids with antibiotics in case of AIDS, meningitis, septic shock, particularly gram-negative septicemia. In blood disorders, idiopathic thrombocytopenic purpura, immune hemolytic anemias. In infective pathophysiology like septic shock, acute bacterial meningitis, if person is having septicemic shock in presence of acute bacterial meningitis, should be. In tubercular meningitis, tubercular pericarditis, tubercular pleural effusion, abdominal tuberculosis, to decrease the fibrotic process, and in this CNS conditions to prevent hydrocephalus, here to prevent constrictive pericarditis, and here pericardial thickening, pleural thickening, and pleural fibrosis, here to prevent intestinal obstructions. It is a must. In renal disease, mainly nephrotic syndrome, most commonly utilized, or also kidney involvement in SLE, or kidney involvement in other disorders like RA, etc. Also, if there is a sarcoid involvement, sarcoidosis involves kidney, it can be utilized. And in membranous variety of glomerulonephritis, or we call minimal change glomerulonephritis, it is a drug of choice. During organ transplant also, it is one of the drug in addition to other immunosuppressions. In allergic disorders like anaphylaxis, serum sickness, angioedema, it is a first drug of choice along with adrenaline. In allergic rhinitis also, it is a drug of choice. This is pemphigus, erythema multiforme. This can be dangerous sometimes. lichen planus. These are erosive ulcers, GI tract, ulcerative colitis, Crohn's, celiac disease. In all these conditions, it is useful. In certain malignancy, particularly lymphatic leukemia, Hodgkin's, other lymphomas, even sometimes in a breast carcinoma also we call hormone responsive breast carcinoma, it can be useful. In cerebral edema, particularly secondary due to tumor or head injury, it is useful. Spinal cord injury, Bell's palsy, neurocystic sarcosis also it is preferred. High altitude cerebral edema, also called as HACE, dexamethasone is useful. In HAPE also it is useful. It is sometimes combined with antiemetic drugs like ondansetron as an antiemetic property. In acute mountain sickness also it is utilized. In aspiration pneumonia, also pulmonary edema secondary to drowning. Hyperthyroidism, thyroid storm also it is utilized. These are non-endocrine use like organ transplant, Bell's palsy, thrombocytopenia, myasthenia gravis, spinal cord injury, sarcoidosis, etc. These are non-steroidal or we call non-endocrine disorders, miscellaneous groups. Topical preparations, good number of time. It is the most commonly for the skin, and these are all the different types of skin disorders. These are some of the skin disease where it will give a very slow response. This will give a very fast response. So depending upon that, you will have to use for a longer period. But when it is used for a longer period, chances of systemic side effects are always likely. So topical preparations can produce some of the side effects like worsening or spread of untreated infection, thinning of the skin, stria, telangiectasia, contact dermatitis, perioral dermatitis, acne, worsening of the acne rosacea, depigmentation, hypertrichosis, etc. All these are because of prolonged use of topical steroids or abnormal use of topical steroid. Very frequently, they go on using without even consultation to a skin specialist. Local steroid injections is very frequently utilized in musculoskeletal and joint disorders like trigger finger, carpal tunnel, Dequerin, tenosynovitis, osteoarthritis, rheumatoid arthritis, gout, chronic spinal pains, facet joint pains, sacroiliac joint arthritis, osteoarthritis, rheumatoid arthritis, etc. And very frequently in this, triamcinolone is most commonly utilized and depot preparations are utilized. When you give injections, side effects of steroids are very frequently systemic side effects. These are local side effects. Systemic side effects like facial flushing, menstrual irregularity, hyperglycemia. You can have a suppression of pituitary adrenal axis, emotional upsets, anaphylaxis can occur very rarely. As far as local side effect is concerned, local flare at the injection sites, depigmentation, subcutaneous atrophy, bleeding, infection, steroid arthropathy, tendon rupture, and soft tissue calcification, quite common. So while giving intra-articular or close to the muscle tendon, etc., you should remember all these local side effects, and these are systemic side effects. You must be aware of all this. Doses, I am not going into detail, but you have to remember what we call as equipotent doses. Equipotent doses means, I'll show you a slide. 20 milligram of hydrocortisone, when you give say 100 milligram, it is almost equivalent to 25 milligram of prednisolone, 5 times. So 20 milligram of hydrocortisone is equivalent to 5 milligram of prednisolone, and you can compare this. This is methyl prednisolone 4 milligram, and this is, so this is almost we can say 4 times more potent. This is 4:1. This is 5 times more potent. This is almost we can say 2 prednisolone it is almost 6 times more potent. So if we compare this, this will be 25 times more potent. Beclomethasone or betamethasone is also that much potent. So this is highly potent. And if you look at the mineralocorticoid activity, in hydrocortisone it is 1:1, while in prednisolone it is 1:2. So mineralocorticoid activity is less in methylprednisolone and prednisolone, while it is almost nil in case of dexamethasone and betamethasone. So this is how you should look at. And this dexamethasone and betamethasone is longer acting. It is acting for more than 36 to 72 hours, while prednisolone is acting for 12 to 36 hours. It is short acting, or we call intermediate acting, and this is very short acting. It is 8 to 12 hours only. So you have to repeat every 8 hourly. So now once you have gone through all the side effects, now you know that in which condition you should not use. If it is absolutely necessary, you have to use with caution. You will have to use the treatment of those disorders. So it is absolutely contraindicated in peptic ulcer disease like GU, DU, GERD, diabetes mellitus, hypertension. These three comes topmost on the list. During pregnancy, again it is contraindicated, but if it is life-saving, it has to be used. In tuberculosis, mycosis, osteoporosis, these are all contraindication. Psychosis, epilepsy because it can precipitate epilepsy, congestive heart failure, CKD, shock, head trauma, traumatic brain injury, infection, hypovolemia in old individual to reduce the fracture bones, Cushing syndromes, pregnancy because it is teratogenic, simultaneously along with NSAID, congestive heart failure, GI compromise, etc. So if any person who has got any one of these, the most common we pay attention to these three common disorders, and in female particularly pregnancy and presence of infections like tuberculosis, fungal infection, etc. or herpes simplex. In all these conditions, steroids should be avoided unless it is life-saving. And these are some of what we call as the relative contraindications. So it should not be used in all those what we have mentioned. Some of the common peptic ulcer, diabetes, hypertension, presence of viral and fungal infection, tuberculosis, osteoporosis, herpes simplex, CNS disorders like psychosis, epilepsy, congestive heart failure, renal failure. These are the most common which we have already mentioned. Now see this also. Hypertension we have called also in presence of suppression of hypothalamic pituitary axis. You should not continue and you should gradually taper off. It is also contraindicated when you are giving vaccine. So if any person who is on steroid, vaccine will be useless. If a person is on a potassium depleting diuretics, decoxing, NSAID, or person is having GI bleeding, and person who is diabetic, who is on insulin and oral hypoglycemic agent, in this, all this, so these two are additional. Person who are given live vaccine and potassium depleting decoxing because it can induce cardiac arrhythmias. So absolute contraindication, herpes simplex, relative peptic ulcer, diabetes, hypertension, tuberculosis, osteoporosis, congestive heart failure, psychosis, presence of viral fungal infections, etc. So these are all side effects we already mentioned. At your leisure time you can go through. Now if you want to minimize the steroidal toxicity, another way they utilize is alternate day therapy. Instead of systemic, use local applications, and always as soon as your target is achieved, start tapering the dose to avoid pituitary hypothalamic axis suppression. These are recommendations on systemic steroid. At your leisure time you can go through. Always evaluate for systemic comorbid conditions, monitor, prevention of the bone loss, and while giving IV steroids, always keep a watch. These are recommendations given by different society. So keep in mind, longer the use, highly potent drugs, you should keep a watch. So dose selection should be proper. Usually single dose is better. Short duration of therapy is always better. Always look for side effects as the duration increases. Use only in palliative therapy. In replacement therapy, it is absolutely indication. In that, take a precaution for side effects and prevent the side effects as much as possible. Dose can be doubled if there is an intercurrent illness, and as soon as that is again controlled, you should start tapering the dose. Abrupt cessation should be avoided. So avoid as much as possible. If not indicated, give it for minimal period, give the minimal dose and stop at the earliest period, but never do abrupt stoppage. Always go for tapering. And during that particular treatment, always observe for body weight, X-ray spine, blood glucose, eye examination, and blood pressure records. While giving a therapy, goal should be achieved and you should prevent HPA axis suppression. That is the main thing which you should do. And to minimize the HPA axis suppression, we have already mentioned that as far as possible, tapering should be done as early as possible as soon as you receive a goal or you achieve a goal. You can use alternate day therapy. Use as much less dose as possible, or we call minimal dose as possible once you achieve the target. So steroid, this is in detail given how you withdraw the steroids. At your leisure time you can go through. These are the symptoms which you develop because of a withdrawal symptom. We have already discussed before. That person can complain of headache, body ache, abnormal behavior, fever, pain in abdomen, nausea, vomiting, etc. There are good number of symptoms which person can develop. Steroid use is absolutely necessary in good number of conditions, but also avoid abuse, because overuse of a medicine without the prescription of a physician or a doctor can produce side effects. Even a topical preparations can have a systemic side effects, local as well as systemic side effect. You should be aware of it. There are some drugs which are called corticosteroid inhibitors like ketoconazole, which is utilized in Cushing syndrome. There is another drug which is antiprogestin, which is utilized in adrenal carcinoma and ectopic ACTH production. Metarapone is utilized in ACTH producing pituitary tumor. Spironolactone is utilized in primary aldosteronism. So these are some of the glucocorticoid inhibitors which can be utilized. Fludrocortisone is mainly utilized along with hydrocortisone as a replacement therapy in Addison's disease. Main mineralocorticoid antagonist is spironolactone, epilerone, and this is another compound which is called drospirenone, which are utilized as mineralocorticoid antagonist. I am not going into detail at present. Now I am going through in short regarding androgens. Androgens are anabolic androgenic hormones which are mainly in the form of testosterone. They are muscle building, and they are for masculinizing character. They are required in person who has got testosterone deficiency. But good number of time it is misused for muscle building. Hence, there is more misuse than use. So, they are basically anabolic androgenic hormone. So, it has got two effects. Anabolic effects, which is increase in muscle bulk, and androgenic effect, which increases masculinized character. By and large, majority of the preparations are synthetic preparations. These are all the different synthetic preparations like durabolin, decadurabolin, stanazoles, etc. This is a big list of anabolic androgenic steroids. Depo, decadurabolin, dynabol, oxandrone, oxymetholone, stanzol. These are all the different preparations which are available, and they are mainly utilized for muscle building, which is we call as abuse. These are all the different oral agents, and there are good number of parenteral preparations. These are all parenteral preparation. These are oral agents which are available. There are some good use of androgens. In male, if a person is having hypogonadism, it is a must. It is a hormone replacement therapy. Anabolic effect is utilized for osteoporosis. A person, a male with a delayed puberty, for growth stimulation. In female, endometriosis, breast tumor. Must. So anabolic effect is utilized in osteoporosis, catabolic states, CKD, angioedema, hereditary angioedema, suboptimal growth in a children if a child is having a stunted growth, if there is a bone marrow, hypoplastic bone marrow or hypoplastic anemia, hemolytic anemia, malignant say associated anemias also it is utilized. This is abuse, physical ability in athletes. If you want to enhance, anabolic effect is utilized, but it is mainly and good amount of abuse. Mainly in a male, it is utilized for muscle building and testosterone replacement. They work by acting on CNS, cardiovascular, skin, psychiatric, musculoskeletal system, GI tract, genitourinary and sexual organs. But when you give it in excess, it can produce lot of side effects like headache, baldness, increased incidence of stroke, blood clots, hypertension, LVH, nausea, vomiting, impotence, reduced sperm count, joint pain, aggressive behavior, increased risk of tendon injury, enlarged prostate, shrinkage of testes. This brown color are mainly in male, while in female and male, this severe acne, gynecomastia in male, liver damage, bladder and bowel problems, mood swing, etc. In female, additionally, reduction in the breast size, enlargement of clitoris, facial and body hair growth, that is we call hirsutism, deepening of the voice and menstrual irregularity. This is given in one single slide, very nicely explained. So these are the side effects in male. We have already shown you in these previous slides. There are some which are additionally mentioned like insulin resistance, high cholesterol, fluid retention, increased chance of MI, risk of kidney damage, etc. Impotency, even decreased sperm counts. These are some of the side effects like acne, liver damage, gynecomastia, depression, shrinkage of testicular size, extreme aggression, hypertension, cardiovascular disease, low sperm count producing impotency. In younger individual, it is called younger-roids because it is utilized mainly for muscle building, etc. It can give one harmful effects like severe acne on the face and the back. You can see this severe acne, baldness, early baldness, stretch marks, bloated out, skin infection and at the injection sites, and some of the side effects are permanent. On muscle and joints, aching joints, muscle cramps, tendon ruptures, liver damage, even person can develop liver malignancy, hypertension, hyperlipidemia, acute MI can develop. As far as brain is concerned, stroke, headache, psychological problem like roid rage, aggressive, irritability, mood swing, anxiety, panic attacks, depression, suicidal tendency, in GI tract, nausea, vomiting, diarrhea, secondary infections. You can have even HIV, AIDS, very common, gynecomastia, quite common, infertility. In female, enlargement of clitoris, deepening of voice, hirsutism, irreversible pattern of baldness. You can see typical breast atrophy, hirsutism type of features, menstrual irregularity. In teenagers, bone growth can be hampered and person can be of stunted growths. So these are more of abuse. It is also misuse in animal also. So instead of use, it is more of abuse mainly to build up body. So anabolic effect is more utilized than, sorry, so anabolic effect is more utilized than androgenic effect. But while getting an anabolic effect, you get even androgenic effects. So do remember, while anabolic effect, you are going to have more of androgenic effects also. And those are, we call side effects. Absolutely lot of side effects. And good number of time it can be detected by doing a doc test. And then also social problems. These were the people who were detected to have a doc test positive. They won the medal, but the doc test was positive because of misuse. So I end my lecture here. I hope this lecture will be helpful to you and you will use properly glucocorticoids, and when you are using anabolic hormones, that use also you will prevent abuse and you will have more use of those drugs.